So when I looked at what was going on in other parts of the world, I looked at Europe and I looked at the US, and the coronavirus was shutting down hospitality. And I knew sooner or later that that would come to Australia. And when I thought about the work that we did, and for 60 years we've been making commercial dishwashers and installing commercial kitchens, I knew our business was about to grind to a halt. For over 60 years, Sirron in one form or another has been supplying commercial kitchen equipment to hospitality. In addition, we've got a chemical business that also supplies detergents. And hospitality is our game. On the 15th of March on a Sunday night, I couldn't sleep. And I was tossing and turning, and what I realised is if we didn't change what we did, we'd be in trouble. So we got the team together on Monday the 16th, and we said, we're going to make hand sanitizer, and by Wednesday we'd sourced raw material, packaging, we'd made labelling, we'd done all our pre-production work. The following Tuesday we started making up to 5,000 5-litre containers of hand sanitizer per day, and we did that for several weeks, and it was awesome. The effect the pivot had on our business was far bigger than we ever would have thought. 12 months later, we're sitting here, we've got 230 products into 5 large supply chains. We've got 4 major projects on the way, ready to be launched. And we've also taken a position in a company called Logical Health Products, which has a license to make TGA approved products. It's absolutely a dramatic shift in what we were doing a year ago. Add to that the strength of our equipment business, and we've got ourselves a really robust company.
My role here is operations manager. Basically, it's managing the supply chain from start to finish. My concerns at the start of the pandemic were I just purchased my first home. The supply chain was coming to a halt in China. We couldn't source any material, so they were the key concerns.
I was very nervous about job safety to start with, and then after a few weeks, due to higher up in management, I knew that we were all right. My role here is chemical manufacturing. I was 100% confident that the business could do that, and it was going out the door really quick, like as quick as we could manufacture it. We're loading them up, and the very next day we manufacture the same again, and it was just continuous.
I'm really proud to work for a company that makes products that are proven to kill a coronavirus, and we've got the paperwork to prove it.
What really made the pivot possible from an internal perspective was just awesome staff. Our team were amazing. They did whatever it took to make it work. And secondly, we had a really supportive board. One of the things I really loved about this time was the way the network of our community worked. And some standouts were Dave Fleming from Oz Industries.
Hi there, my name's Dave Fleming. I work as an Innovation Connections Facilitator for the Innovation Connections program for Oz Industry. My role is to help small to medium-sized enterprises engage and connect with research organisations to help them develop and validate their new innovations and technologies.
Yeah, when we realised that we had a formula that we thought would kill a coronavirus, I didn't know who had a coronavirus. I thought, I bet you Dave Fleming does. And I bet you he knows. And I remember ringing you going, Dave, do you know I'm with a coronavirus? And I think I said in a good way.
Yes, I think I remember the conversation, Greg. So one of the key benefits of my job is that I'm connected not only locally to a range of researchers and companies, but I've also got a national connection. So that allows me to go much more broadly for local companies to connect with the right expertise. Now, when Greg called me about his need to get some testing done for the new product around corona the coronavirus. There were a number of researchers I could have gone to, but luckily for us, there was a key researcher here in Newcastle at the Hunter Medical Research Institute, Associate Professor Nathan Bartlett. And Nathan has got a COVID lab already established. I had a connection with Nathan, and it was really easy for me to connect Greg and Nathan together to have that initial discussion, which I think we did in record time, within about a day or two. And soon after, I think you were able to get your product into the lab, and the testing got underway, Greg.
Associate Professor Nathan Bartlett. I am the head of the Viral Immunology and Respiratory Disease Group based at the Hunter Medical Research Institute, which is a collaboration with the University of Newcastle. I thought that Greg had an excellent idea. I was impressed by his enthusiasm and passion, that level of insight and understanding and desire and enthusiasm to address that problem. The fact that it was not reliant on ethanol as the active antimicrobial agent, it was clear to me and certainly to Greg at the time that measures, long-term measures, were needed in society to deal with living with COVID. The active constituents of Zexa essentially just breaks down the structure of the virus. The virus is surrounded by an envelope, which is essentially a fatty membrane with proteins in it. And what the active ingredients in Zexa does is essentially just dissolve that envelope and destroy the proteins that surround the virus. And this very effectively renders it completely non-infectious.
The first time I had confirmation from you that the formulations we had killed the coronavirus was you emailed me this chart. I had no clue what it meant. And I got the text on the bottom which basically said real positive result. I'm like, oh really? What does it mean? And so I remember jumping on the phone quite quickly and saying, what does it mean? And you started to explain in your professor speak the effect of our products on a virus, and I knew that we were onto something. It was just a question of how we progress it, and it was exciting because it started for us from a thought that we can try and help, and when people couldn't get anything, we thought that we would try and make something, and to see it develop and have you as part of the journey, which is a significant part, because if it didn't work, we wouldn't have gone on with the rest of it, which was to continue to invest in processes and facilities to enable us to bring a product to market that can kill a coronavirus. All of the cost we saw as an investment, and at the base of that investment was the work you did, Nathan. Thank you. The third person that was a standout was Catherine Duncan from the Department of Regional New South Wales, and she was tasked to enable manufacturers to quickly make PPE. She introduced us to Logical Health Products, who now Sirron is a shareholder. If it wasn't for the contribution of those three people, it would have been a very different outcome. The product that we made is a non-toxic, ethanol-free, spray-on and leave product, and it passes all the criteria that the Therapeutic Goods Administration put on any manufacturer in order to make that claim, so you know it's safe. So here we are, standing here with our first production of Zexa, surface sanitizer, hospital-grade disinfectant, proven to kill coronavirus. This couldn't have happened without our amazing staff and some awesome external advice. I suspect this is not the end of the story and only the beginning.